how did we get to this point? And the only conclusion that I can come to is that without the foundation, we wouldn't even be close to where we are today.
30-some years ago, Ortonville Area Health Services and Northside Medical Clinic and partners came together along with the community and many influential people to start the Big Stone Healthcare Foundation. And I like to say they're about 25 years ahead of their time.
We have 7 foundation board members who are appointed to serve on the board, and then we hire 1 foundation director for the operations of the Big Stone Healthcare Foundation.
I have been with the foundation for about 2 years now, and it's just a really special organization. The people, the accomplishments, and the history of the organization, what has been done in 30 short years is just really amazing, and I'm proud to be a part of it.
When we moved over to Fairway View Neighborhoods, our staff and residents were in at awe. Without Big Stone Healthcare Foundation moving this campaign forward, I think they made our dream come true. It was a reality that we walked into the day that we moved in March.
The foundation has run 2 highly successful capital campaigns in recent years. Completing the vision was Fairway View Senior Community Neighborhoods, and Building a Healthy Future was the hospital replacement project. Both of these campaigns had donations from community members, pledges, staff payroll, came together to make these big dreams a reality.
I don't know how many people, remember the old hospital. I mean, it served its purpose, but we were definitely in need of an upgrade. So it was great.
Our family has been involved with the foundation for a long time.
Well, our dad has volunteered with the Oak Tree golf tournament for a while, so I just always remember him working on that. So I was excited to get involved too.
Born and raised here, Dr. Bob actually delivered me. He delivered my kids. Graduated high school here. To have the opportunity to work at Ortonville Area Health Services, have the opportunity to be a part of the foundation, helping carve the future and what that looks like, I just can't imagine anything else.
The Oak Tree Golf Tournament started out as a small tournament and has grown to be a big fundraiser, a fun day where we get a lot of people involved, play a little golf, and raise some significant money for the foundation.
We have volunteered in some capacity since probably 2014 or 15. We actually got involved with it because in 2014 my mom was attending the gala and she had an extra ticket, and so she asked her favorite daughter to go.
Which I couldn't go, so then she got to go.
That's one of the best things about the gala is that it is open to the entire community. I think it's probably one of my favorite things to do.
I'm really in it for Dr. Bob's speeches. I enjoy hearing those.
The anticipation of what's about to be said.
Yes.
I agree. It never lets you down. I would also say just being able to have a really good night on the town.
And it's great to see everybody having a good time outside of work, and you can really see all the relationships that are built inside these walls.
The foundation considers people to be our biggest investment. Each year, the Big Stone Healthcare Foundation issues 2 high school scholarships. We fund staff that are going back to school to further their career at any level in the healthcare field. We fund EMT and paramedics that are going back for training, all to ensure that our patients, our community is receiving the best care possible.
I always wanted to come back to the area, and just very thankful that Ortonville had an opening at that time, and I've been very satisfied with the hospital and the organization ever since.
When I was going to medical school, the Healthcare Foundation helped me at that time with scholarships.
The foundation allowed me to come back home. I grew up here, went to school here and graduated from OHS in 2002. So I went off to school, moved around a little bit, and then really decided I wanted to come back, and they gave me the opportunity to help repay some of my loans and relocate back to my hometown.
When I was applying here and I was finishing my residency, the Healthcare Foundation also helped me a lot.
We had that focus of people first, and from that we are now able to continue to grow and and be there for more people in this area because we have the providers that people are looking for and the access to care that they need.
We can continue to grow from here. You know, I remember when we built a new clinic, and I walked through that clinic and I thought to myself, how in the world are we ever going to fill up this place? And what are we going to do with all these exam rooms? And just a few years later, we don't have room for the new physicians. I think whatever your imagination can think of, we're capable of doing that.